Good morning. Good morning, everyone. On behalf of the mental health sector, I'd like to thank the Victorian Government and the Department of Health for being so responsive. It was only a few weeks ago that Pat and I started discussions with Health and with the Minister around options to address some of the immediate to short-term needs of the community, and it has been particularly heartening for us to see such a rapid response. The package that has been announced this morning will provide an enormous level of support to people within the community, within Victoria, and it will draw on the strength of community health and community mental health organisations across the state. And they are in many ways the unsung heroes of the mental health sector. We will see support reaching out across the state, which is absolutely fantastic, and tailored particularly to the particular needs of local communities, and that's part of the strength of community health and mental health. They know what's best for local communities, they're hooked in, and they understand local conditions and local needs. We are really very pleased that this has been announced today, and as Pat says, it will act as a bridge to the broader reforms that will start to come online from the middle of next year. One point I would like to make, though, of course, is that mental health is a dual federal and state responsibility. We gave the Commonwealth top marks last year for their very quick response a year ago in September, and the establishment of a program across the state. But conditions have changed very considerably since then, and we call on the federal government to at least match the commitment that's been made today and roll out additional services on top of what's already been committed. Thank you very much indeed.
Good morning. I'll take you through some of the key numbers and outbreaks related to the current COVID cases, as the Deputy Premier mentioned. So to take you through the outbreaks of interest first, the Panorama Box Hill construction site, day 13 tests commenced yesterday, and we now have a total of 136 cases identified from that outbreak, including 37 staff and 99 household contacts. We may see additional cases coming through as a result of day 13 tests. The Greenvale School construction site, again, we're starting day 13 tests for that today, and there are 4 cases so far associated with that outbreak, 270 close contacts going through day 13 tests. With respect to the Fitzroy Community School, we now have 33 cases amongst that cohort, being students, teachers and household contacts. That's an increase of 4 since yesterday. With respect to V-Line, an additional case is in today's numbers, another driver who resides on the Surf Coast. That driver, pleasingly, has been in isolation for their full infectious period, so we now have a total of 6 cases amongst that outbreak from the work site at Southern Cross. Following assessments from the public health team, V-Line has been able to recommence some limited train services today, but there are still coaches replacing trains on some lines. We have 3 positive cases now associated with a manufacturing facility in Campbellfield. That site has a total of 12 workers, so has closed while we go through the public health actions. Yesterday, Jerome spoke of a site at a Ballarat Residential Disability Centre, a fully vaccinated worker. Pleasingly, no further cases yet associated with that site. With respect to geography of cases, we know, of course, there's been concern in the north and west of Melbourne, and 74% of today's cases are in the northern suburbs, including 175 in the LGA of Hume, 64 in Moreland, 36 in Whittlesea. In the western suburbs, we've seen 38 in Wyndham, 16 in Melton, 14 in Brimbank, 15 in Hobson's Bay, and in the southeast, 6 in Casey, 5 in Greater Dandenong, 5 in Port Phillip, and 4 in Glen Ira. We're particularly concerned about certain postcodes and suburbs in the north of West, and I'll go through those now. If you live or work in these suburbs, because we have even seen some of our regional cases where people live in the regions but may work in these areas, please be extra vigilant and really do get tested at your first sign of symptoms. 3064 Roxburgh Park and Craigieburn. 3047 Broadmeadows, Dallas and Jacana. 3048 Coolaroo and Meadow Heights. 3061 Campbellfield. 3059 Greenvale. 3046 Glenroy, Hadfield and Oak Park. 3060 Faulkner. 3029 Hoppers Crossing, Truganina and Tarneet. 3030 Werribee South and Point Cook. And 3025 Altona East, Altona Gate and Altona North. So please, those 10 suburbs are where we're seeing the vast majority of our cases in the LGAs I outlined before. So again, if you work or live or have any association with those suburbs, please come forward and get tested. We have 3 new regional cases today. The train driver in the Surf Coast related to Velo that I've already mentioned. A case in Ballarat who is a construction worker and works in Melbourne. And a case in the Mitchell Shire who works in one of the suburbs of concern that I have listed. Pleasingly, for the second day in a row, no further cases in Shepparton. With respect to vaccinations, yesterday we delivered 36,615 vaccine doses at our state-run hubs. And of those, 2,014 were in the newly eligible cohort of 12 to 15-year-olds. So that's fabulous for day one. 78,000 total bookings were made yesterday, including another 1,600 for that new 12 to 15 age cohort. And in terms of booking availability, we have 11,000 AstraZeneca bookings available online and 3,000 Pfizer appointments. So please, if you haven't yet made a booking for your first dose, hop online and lock in those appointments. Yesterday, with respect to tests, we delivered almost 43,000 tests, and pleasingly, the system is holding up really well. There are no delays to test results. We're delivering 99% next day after you have your test. Again, some of the cases in the northern and western suburbs, they're the primary income earners for those households. So if you're concerned about isolating while you wait for your test result, even though it'll be delivered the next day in over 99% of cases, a reminder that you are eligible for the Victorian $450 isolation payment. Jump online and submit an application so that you can get your $450 while you're waiting for your test result. Ignoring the symptoms won't make it go away, and again, we really do hope that you come forward and get a test at the earliest sign of any symptom. A reminder, it could be fever, it could be a sore throat, it could be a loss of taste or smell, or it could be nausea or diarrhoea. So please come forward, or even a headache. One change to restrictions in terms of a small change to our authorised worker list in Greater Metropolitan Melbourne and Greater Shepparton. As always, that list is always under review. Throughout this lockdown, pet grooming has been available for urgent needs. However, as we enter the warmer months, and that's evident by this beautiful spring day here in Melbourne today, we confirm that grooming will be permitted for non-urgent and regular grooming needs as long as it's conducted outdoors and is contactless and conducted solo. So that is one change to the restrictions that we're bringing in.